Hey guys, have you guys ever wondered what Lyme disease really is? What getting bit by a tick can really do to you? Or may if not taken care of properly? Here, let me give you a little input on what I found out. Lyme disease is the most common tick-borne illness in North America and in Europe. It is a disease of arthritis, which is caused by the bacterium called Borrelia burgdorferi, which is an agent of Lyme disease. This was first recognized in the year 1975 after researchers investigated why an unusually large amount of children were being diagnosed with juvenile rheumatoid arthritis. In 2011, 96% of Lyme disease cases were reported from 13 states that include Connecticut, Delaware, Maine, Maryland, Massachusetts, Minnesota, New Hampshire, New Jersey, New York, Pennsylvania, Vermont, Virginia, and even Wisconsin. I know it's a lot to say and think about, but it's true. This is the most commonly reported vector-borne illness in the U.S. In 2011, this was the sixth most common nationally notifiable disease. It is known that the flu-like symptoms can be part of the disease, such as fevers, headaches, chills, but it does not automatically mean that you do have Lyme disease. Some of the causes of Lyme disease include basically a deer tick, which the bacteria that I mentioned before, Borrelia burgdorferi, does carry. They basically feed on the blood of animals and humans, and it can harbor the bacteria and spread it when they do feed. The deer ticks are known to be brown, and when young, they are often no bigger than basically a pin head, or head of a pin, which can make them nearly impossible to spot on you or your dog or anybody. An infected deer tick must bite you, then the bacteria enters your skin through the bite, and eventually it makes its way into your bloodstream. To change this disease, though, a deer tick must be attached to you for about 36 to 48 hours. I know it's a long time, but hey, the second you see it, take it right off because you never know. They do have symptoms that do go with this. Some vary and can usually affect more than one system. You have your skin, your joints, your nervous system, which are the ones that are truly most affected by this. They have early signs and symptoms that may occur within a month after you have been infected. For example, like I said before, the flu-like symptoms. You get the fever, the chills, the fatigue, the body aches, and the headache. You can also get a rash called the erythema migrans. This is the hallmark of this disease. It occurs in about 70 to 80% of the cases and starts basically as a small red dot and can expand into everywhere all over your body. It can do it within days or weeks, and it forms a circular, triangular, or oval-shaped rash, which is basically called a bullseye pattern. So basically when you're playing bullseye, that dartboard, that's what it basically is, kind of. You also have some later signs and symptoms. These develop severe joint pain and swelling. Your knees are especially likely to be affected by this, but the pain can shift from one joint to another. It doesn't just necessarily stay there. You do also have neurological problems. I know what you're thinking. Where did this all coming from? Why just getting bit by a tick can this do this? And how come it deals with the neurological problem? But because it goes in through your bloodstream, it affects a lot. With these neurological problems, though, it can be weeks, months, or even years after you were infected that you may experience maybe inflammation of the membranes surrounding your brain, which is known as meningitis. You can also have temporary paralysis on the side of your face, also known as Bell's palsy, and neuropathy can be a part of this too. Now, if you guys know what Bell's palsy is, it's basically, like I said, your face is down and droopy, and you don't want that. You don't want any of these kind of problems. It's crazy. They do have also less common signs and symptoms. You have several weeks after the infection, some people can develop some heart problems, such as an irregular heartbeat. You can have eye inflammation, liver inflammation, severe fatigue, so you're tired all the time. Ticks can also transmit other illnesses, such as babiosis or Colorado tick fever. Reading and finding this out was absolutely nuts. I did not believe that getting bit by a tick can cause so many problems. Your risk factors do include spending time in woody areas or grassy areas. The children who do spend a lot of times outdoors, which are basically almost every child because they love to be outside and playing with their friends. You have adults that do work outside. Those are also at a big risk for them. your skin being exposed, your pets always running around into the woods. Now, a lot of us like to go quadding or hunting and or just fishing or anything like that. When you're doing those type of things, you want to be careful, especially if you are going to be out there for a while. Make sure you're covered because you never know what can happen. You can get bit by anything. And I know that Lyme disease isn't the biggest disease ever, but it does cause things that you don't want to happen to you. To diagnose this, you can either do a physical exam, some lab tests. They have something called an ELISA test. It's an enzyme-linked immunosorbent assay. This detects the bodies of the bacteria, and sometimes it can provide a false positive because it's not just used for this diagnosis. They also have a Western blot test. If your ELISA test is positive, they do that one, and it detects antibodies to the several proteins of the bacteria. And a PCR, which is a polymerase chain reaction. This basically helps detect the DNA bacterial in a fluid drawn from an injected point. I know you're probably thinking, these tests, what are they? But being a nurse, learning this was pretty cool as well. Your treatments and your drugs basically deal with antibiotics. They're basically from 14 to 21 days. You can do an oral antibiotic, which is basically the standard treatment that they do for Lyme disease, especially in the early stage. Some of the names would be the doxycycline, amoxicillin, or cefuroxime. The last two, the amoxicillin and the cefuroxime, are basically for young children and any pregnant women that are breastfeeding. You can also have an intravenous antibiotic, which is basically for your central nervous system. So that kind of just gets that going. To prevent this type of disease or getting bit by a tick, I mean, you can't always prevent getting bit by a tick, but if you try, you can succeed. You want to wear long pants and long sleeves. You can do insect repellents. They say that you can tick-proof your yard, but I don't really know how you can do that unless you just use the insect repellents, unless they have some. I tried figuring that out, but it didn't work. I can't find it anywhere. You also want to check yourself and your children and your pets for ticks when they come inside, just to make sure that they're safe. And if you do, remove the tick as soon as possible with tweezers. I found a tick on me once. I removed it. I burned it. It makes this weird, cool popping noise, but be careful with the fire. You don't always want to just do it like that. With the fact that most of us, including myself, live or play in the wooded areas, just remember that getting bit by tick is serious, and you want to always wear protective clothes. My brother 2 years ago had this, and we didn't know what it was. It took lab tests. We went to a dermatologist, we went to a regular doctor, but getting blood tests and figuring out what it was, we were able to catch it in an early stage, so he was able to take the antibiotics that he needed. But like I was saying before, you can't prevent this, but it's good to always try, because this is, as you can hear, a very serious disease, and I didn't realize it until I started researching this because of my brother. Now that I have every one of you falling asleep on me, because I know this wasn't the best informative speech to give on, there's so many other things I could have done, but being, like I said, wanting to become a nurse, this kind of stuff is pretty cool to me. So if I can give you guys the information, even though I know you guys, most of you probably know it, it's helpful to me because I like to help people out as well. And I hope you can all put everything I said into consideration, especially if you're going to be outside with summer coming along and everyone loving to ride quads. That is all. Thank you.